I want to talk about some common mistakes that people make when they have very good intentions going to classes like yoga and Pilates. This is an important message for you to hear if you struggle with hip or back pain. So what are some of the common mistakes people with hip and low back pain are making in these classes? The big mistake that most are making is that they're cranking too hard into extreme ranges of motion. So either extreme hip extension, taking the far too far back, or cranking into extreme in-range hip flexion. I want to focus today on the mistake of cranking too much into in-range hip flexion. So let's review a little bit of hip anatomy. So here is the hip socket called the acetabulum. On the rim of this acetabulum you have your hip labrum. So it's just this fringe of cartilage that hangs out here on the edge of the joint. Here's the femur. The femoral head sits right in that acetabulum. So it's not the movement of hip flexion itself that's problematic. It's a problem more of not respecting your anatomy when you go into that bending movement. Sometimes people will run into a really firm, hard infield when they take their hip up into extreme amounts of hip flexion. Sometimes this can happen because of a person's anatomy. So some people will have an extra bony growth built up called a cam morphology. So it's just extra bone that's built right here on the neck of the femur. And what that can do is that can cause motion limitations, especially when you're sitting, when you're going up into hip bent positions. Why is this problematic for someone trying to push their range of motion in yoga? Well, you remember this labrum, this fringe of cartilage that we all have that sit right here on the edge of your hip socket. If someone with a cam morphology pushes too much into hip flexion, what can happen is you can ride that cam bump right up into your labrum and cause what's called a delamination tear of the labrum. It's not an acute injury, but over time it can cause some issues if you slowly cause that labrum to peel up off of the bone because you're pushing extreme ranges of motion in a way that doesn't match your anatomy. Another problem with forcing unnatural hip movement when you're forcing your hip into that bent position is that if you run into a bony block when you bend or when you're trying to stretch, this can create unnatural forced rotation through your spine because your body doesn't have anywhere else to go. If you struggle with persistent back pain, we know that poor control of rotation is actually a very common driver of those persistent symptoms. If you're constantly standing and moving in ways that causes this subtle twisting through the back, that is definitely something that can cause symptoms to linger for long periods of time. And when you force yourself into doing stretches that are unnatural for your hip, this can just feed into that rotational problem through your spine and through your core. Other considerations about anatomical bony blocks that can be present in some individuals with hip and back pain are how your hips are oriented naturally in space as a product of your unique anatomy. Some hips are oriented more forward in socket and some are oriented more backwards in socket. Let's talk a little bit more about this. When hips are oriented more backwards in socket, you have what's called a retroverted hip. Someone with a retroverted hip is going to have more outward spin to their hip than inward spin. These are typically people that may turn their feet outward when they walk or run. These are also people who can sit Indian style very easily. These individuals will tend to reach in-range hip flexion or bend earlier in range than someone that doesn't have a retroverted hip. If you think you have a retroverted hip and struggle with recurrent back and hip pain, you should be careful with poses and movements such as these. When hips are oriented more forward in socket, you have what's called an anteverted hip. Someone with an anteverted hip is going to have more inward spin at the hip than they do outward spin. These are typically people who tend to have more of an in-toeing gait or have their knees turn more inward when they walk and when they run. People with anteverted hips really struggle with sitting Indian style. They may also have a noticeable heel whip when they run. If you believe you have anteverted hips and you struggle with hip and back pain,
You'll want to avoid deep hip bending movements that also twist the knee or foot outward, such as done in poses like these. These movements will cause the femoral head to spin out into sensitive soft tissue structures that often get irritated when someone has a hip injury located deep in the front of the hip and groin. Pushing through any of these movement limitations due to anatomy at the hip, say you have a retroverted hip and you're really trying to twist the hip inward, or vice versa, you have more of an anteverted hip and you're trying to force that outward movement of the hip, well, eventually you're going to run into a bony block and all that movement's going to go to your back. This is where the interplay between hip and back pain come in with these people, and this is why it's really common to have persistent hip and back pain when you try to force movements such as these that go against your anatomy. How relevant is hip anteversion and retroversion to people with persistent low back and hip pain? Research suggests that about 30% of people with hip pain have anteverted hips, while about 20% of people with hip pain have retroverted hips. So this really is a very relevant topic for people to pay close attention to if they've struggled with long-term pain deep in front of their hip and groin.
So the moral of the story with extreme positions of hip flexion, don't force it if it doesn't feel natural, especially don't force it if you have hip or low back pain. You may actually be turning to these types of stretches and exercises to actually help your back and hip pain. My advice to you is that if your pain or stiffness gets worse because you're trying to force these stretches, or if you do them for months and months and you don't see any progress with your symptoms, stop doing them. You're probably not doing yourself a favor by forcing something that your body naturally can't do.